This is Conversations in the Clinic. I'm Dr. Kelly. A few days ago, a patient came in with a history of GI issues, gastrointestinal issues, like 20 years ago history. And she goes to her GI physician every year just to check on the status, make sure everything is where it's supposed to be and everything is still good. And it is. And she had to have an MRI done of that area, so of her stomach, basically. And when you have an MRI done of that area, it inevitably includes the lumbar spine, the lower part of your back. And she said she got the MRI results back and everything was fine with her GI system. Thank goodness. She said, but I couldn't help but notice that it said degenerative disc disease about my lumbar spine. And that frightens me. She asked me, is that something I need to be frightened about? The short answer is no. No. Degenerative disc disease is the medical way of saying like wrinkles inside your spine, right? Wrinkles like the wrinkles that appear on our face or the gray hairs that appear on our head as we get more birthdays. If we took 100 people off the street, upwards of honestly probably 50 years old, at least 50% of them are going to have some type of degenerative disc disease. So it's not something to worry about. And it's really important that we don't let it spike our cortisol levels, our stress hormone levels, because then it could be a problem. It's funny, like only when you find out about the degenerative disc disease does now all of a sudden your back start to hurt, right? And I like to always reference a study that was done. I have to see if I can find it, where they took 100 people, 50 plus years old, I'm going to say, and they did just this. They imaged their spines. And they didn't tell the radiologist which of the patients 1 through 100 had any kind of symptoms. And all they did was they asked the radiologists, based strictly off of these images and knowing that it's patients above their 50th birthday, who do you think is in pain? So the radiologists look, okay, this person's back looks like it's a mess. They got to be in serious pain. This person's back looks completely fine. They're probably not in any pain. They go through 1 through 100. When they correlated the radiologist's interpretation or best guess with who was in pain, there was like very poor correlation. So there are people walking around with backs that look on an image really messy, and they're walking around completely fine. And there are people walking around with beautiful, beautiful anatomy in their backs, and they're really hurting, which just goes to show like pain is a complicated beast. It's multifactorial, especially back pain. And um, we should not let it scare us. We should not let our images scare us. They're sometimes a piece of the puzzle, but very rarely do they tell the whole story. I actually just had a patient who had a lumbar surgery because she was having nerve pain down her leg. She's 85, by the way. And she said when her physician, the guy who did the surgery, saw her image and she came in, he said, were you in like a really bad accident? And she said, no. And he said, well, your back looks like it was. And she wasn't. She just lived her life and kind of and she's an exerciser, she's a mover, she's strong, just happened to get symptomatic to the point where she needed a large intervention, and she's doing awesome. But it just goes to show you that we need complete and accurate information before we make a decision, before we get emotional about a situation. And in medicine, it's really hard to get completely accurate and complete information. So we have to make presumptions and go down paths that we think are going to be the best course of action to treat the patient. Um, but I was really grateful that this patient came into one of my exercise classes and we had that conversation, because I could immediately just de-escalate her fear, which I can say with fair certainty is going to prevent problems with her back in the future, simply because she now has like empowerment. She doesn't have to be afraid of what she knows now exists in her back, the same way that wrinkles and bags come under our eyes and gray hairs show up on our heads. Um, that's all that is. So, um, I would be remiss if I didn't say, like, staying strong will help people stay asymptomatic. They'll never know if they have a degenerative disc disease or not if they stay strong. A lot of the times people get symptomatic when they get weak or they stop moving, or life happens and someone cuts them off in traffic and their cortisol spikes and it ends up talking to them in their back. So stay strong, keep moving, keep getting better every day. Thank you for spending your time and your attention with me today.